cégnek vagyok a vezetője. Köszönöm szépen Zsoltnak a helyszín biztosítását és ezt a lehetőséget. Engedjétek meg, hogy bemutassam Mário Goisis. Olaszországból, Milánóból jött hozzánk, és a Microfat injekciós technikáról lesz ma szó. Kolléganőim is itt vannak a környéken, Piró, Bori leült hátra, Hédi és Edith is itt van. István fog segíteni azoknak, akiknek az angol egy kicsit nehézséget okoz a fordításban. Szóval mindenkit szeretettel köszöntünk, és Márióék ketten jöttek, elhozta Nina kolléganőjét is, aki szintén fog tudni segíteni, és most az elképzelésünk az az, hogy tart egy elméleti előadást, amiben remélem a videók is majd működni fognak, és akkor utána meg egy gyakorlati bemutató. So, sorry to talking in Hungarian, so I switched to English, and I just introduced you and to my colleagues. And István helped me with the translation, and I'm happy it's more or less is working.
Thank you very much. When we talk about our system, our Microfat system, I always show this painting is a painting made by Piero della Francesca. He's a famous painter of Italy. This painting is in Milano, and at the center of this painting there is a strange thing. It's an egg suspended by a chain. And I like to speak about fat injection as a chain with different links, with different steps. From fat harvesting to removal of blood to injection of fat, every step is important. And because a chain is only as strong as its weakest link, it's very important to avoid a weak link in our system. Because also one weak link will destroy our fat. And so it's very important to preserve our fat, because if we will destroy our chain, we will not have results. We will have destroyed our cells, and so we will not have a permanent effect. So for this reason, it's very important to do every step link by link. And Nina, do you want to go on?
Of course.
Go on and describe to these doctors the simplicity of the process.
Good morning, everybody. I'd like to introduce myself to you. I recently graduated from medical school in Italy, and I just recently became interested in aesthetical medicine. And I am really happy and enthusiastic to show you our product, because even I, as an absolute beginner, I found it very intuitive to understand and very, very easy to use in the clinical practice. So I'm sure that you as experienced practitioners will find it very useful. So let's first take a look at the procedure. The peculiarity of our system is, first of all, a cannula that has a smaller diameter compared to the classical one. It's only 2.1 millimeter, and it's full of small holes, and it's aimed to be used with a rotational movement. There are two kinds of edges. The depressed edge helps with an increased fat entrance, and then you have the other edge who is slightly barbed, and it helps the dissection of the fat. And here you can see the spiral distribution of the little holes. So let's take a look at the quality of the fat that we are grafting with this new cannula. You can see this is the fat grafted with Goisis cannula, so you can see the quality is very good. The cells, the adipocytes, are not disrupted. While if you take a look at the ones that we have taken with a common cannula, you can see the quality, it's not as good as with our. Another key aspect of our cannula is that it helps us to work on a more superficial level, And as a result, we can take a bigger stromal and vascular component, thus allowing us to take a big quantity of stem cells that are very useful in the procedure. Another device that is called backlog, it's a special syringe that helps us to maintain a constant negative pressure and also prevents the excessive hand fatigue of the practitioner who is performing the procedure. The result is a rapid and easier cell fat harvest. And another very good result that we obtain is that not only we are able to not disrupt the adipocyte component, but also the mesenchymal one. The second step is after we grafted the fat, we have to clean it from the anesthetic because in the longer term it's cytotoxic, and to remove red blood cells and white blood cells. In order to do this, we have a filter that lets red blood cells and white blood cells pass and separate the adipocytes who have around 100 micron diameter. So here you can see how it works. You see the red blood cells can pass, but the adipocytes can't. You can see with other techniques like decantation, the fat that you obtain has a much greater oily texture and a bigger quantity of red blood cells that you can see here down on the right. With centrifugation, the quality of the fat graft is decreased because of the disruption, and you also have a smaller quantity of red blood cells, while if we wash the fat and then we add filtration, this is the result. So as you all can see, it's very good. And the final part we have to take care of is the contact with air that we want to avoid at all costs. And this is really easy because it's a closed system, so I don't have to worry about it while I'm performing the procedure. So finally, the key aspects of this new kit and this new device is that it's really simple to use. Even I, that I'm really nervous right now explaining all this, I do not have to worry about a thing and just go on and perform my procedure. The pressure is constantly applied with the right amount of force, and there are no risks of infection and air contact. Moreover, our procedure is standardized regarding filtration. So that's it. I'll let my colleague continue.
Thank you, Nina. And yes, with our system we have an automatically opening of valves. So that's the main advantage of our system. So you will see, you will not have to turn any kind of stopcocks. It will go on automatically. And if you have an increase of pressure in some part of the system, you will have an automatically opening of some other valves. And in this way, we will go on in order to preserve our fat. And is efficient. It's efficient because it's fast, so because it will reduce the time of harvesting, and it's very important because our time, it's our work, and so it's our efficiency. And because we have also reduced the fat consumed. And that is quite important because you know that you have experience in fat harvesting. If we are thinking about a medical procedures, not liposuction, we want to offer a full face treatment to our patients. So we have to harvest a small amount of fat in order to reduce the pain and the problem in the harvesting area, in order to reduce the cost, the biological cost of the procedures, and also in order to offer this kind of procedures also in slim patients. We have so many slim patients in which it's very simple to harvest 20-25 cc of fat, but it's more difficult to harvest 100 cc of fat. So for that kind of indication, our system is particularly efficient. It's very different from the classical injection, also the injection of our system. I'll speak about injection. It's very important. You know that after injection, this is a very interesting article published on plastic reconstructive surgery, only a small amount of our fat will survive. So only the external part of our fat will survive. So it's very important to inject a small amount of fat. In this way, our system is very different from the classical system, classical injection system, classical injection harvesting, like the Coleman technique. The system doesn't work now. With Coleman technique, you know, we are using a very big cannula in order to harvest the fat. We will do a big concentration of fat because of condensation by centrifugation, and we will have to inject the fat with a classical Coleman technique with big cannulas. So we will inject fat with 2 millimeters, 2.5 millimeters diameter cannula. In this way, usually, we will inject a great amount of fat, so with a lot of necrosis. But first of all, when we speak about lipofilling to our patients, we have to disclose that our procedures is totally different from the classical Coleman procedures, because that is not a complication. It's the book of Coleman. And in this chapter, Coleman say, when you do lipofilling to your patient, say to your patient that for 2 weeks she or he will have to stay at home, and for 1 month she will have edema and sign, because that is the image 3 days and 2 weeks after the procedures. Why? Because with the classical lipofilling, Coleman was the first one to describe and to introduce with a lot of books and other things lipofilling. We have to inject fat with a big cannula. And if we inject fat with a big cannula, with a 2 millimeters cannula in the lips, of course, the day after the procedures, the patient will be like that 4 days. And after 3 weeks, she will be like that. Because we are doing a surgical procedures. We are not doing a medical procedures. When we do our procedures, when we will do on our patients our procedures, we will inject our fat with a small cannula, and we want to obtain a natural and stable result, of course, in terms of volume augmentation, in terms of correction of the shape of the face. But the day after the procedures, the patients must be like the day after injection of fillers. We don't want to offer a surgical procedures. If we want to do surgery, we can do the classical Coleman technique. We want to offer a new approach, a mini-invasive approach. So that's the aim of our medical approach to it.